This is Manuel, an adorable 7-year-old Spanish-speaking Latinx boy with big brown eyes and thick, shiny black hair. Manuel is a composite based on our experiences of working in communities, and his story illuminates what we believe can happen in schools to promote child health equity. Manuel is a second grader, a bilingual learner at Cesar Chavez Multicultural Academic Center. Chavez is in Chicago's Back of the Yards neighborhood. This place has long been an historically working class neighborhood and home to many of the city's great grand waves of immigrants, to heavy industry, and to social activism. Its Union Stockyard was once the nation's largest meatpacking and railroad center. In those days of the early 20th century, this was a place in the city of the big shoulders marked by appalling illness and injury and environmental degradation, danger and low wages among laborers, which in turn prompted some of the most famous labor union organizing to protect the rights and the health of workers in all of American history. Back of the Yards is a very different place now. Anyhow, this Chicago neighborhood is where Manuel lives with his mother and his abuelita in a tidy, tiny basement apartment. These days, in the quiet moments, Manuel feels both happy and sad at the same time. This is when he most remembers and misses his Poppy, who is also a school custodian by day and an Uber driver by night. On Sundays, Poppy's only day off, they'd sit together on the old sofa in front of the TV to watch soccer all afternoon. When the announcer cried, "Goal!" they leap up in ecstatic embrace. "Dame la cinco, Papi." Pure joy. But joy has been harder to come by since Papi got a cough. In the fall of 2020, Papi fell ill to COVID-19, and in a matter of weeks, he died. Just as so many did, disproportionately, in oppressed Black and brown communities all across Chicago and elsewhere and everywhere. For Manuel, COVID-19 changed everything. They call Manuel's mother a dreamer. She works as a cashier at the Jewel Food Store, and despite the many adversities and losses she's faced in her life, she takes pride in being called an essential worker, just as her husband once did. Pandemic or not, she gets up every day without complaint or protest to do her job, though her wages barely lift the family out of poverty. For Manuel's mother, life is hard, and it got a lot harder after her husband died. Yet, Manuel, like his mother, the dreamer, is resilient. He still loves. He loves Spider-Man and churros and lucha libre. And he loves his abuelita. It was just the two of them against the world, bathed in the blue light of a laptop at their little kitchen table for a year when school doors slammed shut in the early days of the pandemic, and Manuel and his peers were left to learn remote only. That lost year was really hard for Manuel and his family, just as it was, most especially, for so many poor Black and brown people all across segregated Chicago. It was a year marked by both political tumult and labor strife in the streets of downtown Chicago turned red in protest. Sadly, it was also a year marked by the largest increases in educational inequity in a generation. This occurred as Black and brown students were pushed further and further behind their more privileged and affluent peers. For example, private and parochial school students in Chicago, largely white, attended in person all that school year long and relatively uneventfully. Despite the odds stacked against him, somehow Manuel, sitting on his abuelita's lap, learned to read. Manuel dreams of his future. He tells his abuelita he wants to be a doctor and a luchador with his tricky holds and high-flying maneuvers. In fact, he's already designed his mask and his name, El Médico Volador. And even at 3'6" and all of 42 pounds, he is fierce. He wants to take care of sick people so no one dies, he explains. And he wants to vanquish his enemies like COVID-19 in the name of justice. He wants to be essential, like his father was and his mother is, like his doctors and nurses, and yes, his teachers are. And to that, his abuelita says, ¿Por qué no? Sí se puede. That is a beautiful dream, mi nieto adorado. As she leans in and holds his cheeks in the palms of her hands, gazes into his big brown eyes, then kisses him on top of his head. Sometimes Manuel coughs too. He, like 1 in 12 US kids, has asthma, and that figure is up to 1 in 4 in many neighborhoods in Chicago, like back of the yards, which together comprise the epicenter of the nation's asthma epidemic. Asthma is a childhood illness for which there are many remarkably effective treatments. However, racial, ethnic, and class inequities in asthma prevalence, in access to treatment, and in health outcomes are complex, vexing, and persistent. And they are tightly coupled with educational inequities. But you know what? It's going to be okay for Manuel. You know why? Because there is a trained, paid, supported, and connected community health worker integrated into his school. What we've learned from Manuel is this: you can use a simple intervention to make a big difference in health. As we say at Reimagining Schools, let a community health worker save the day. What is a community health worker? A trusted local person, a trained connector, a communicator, a partner in health. Why community health workers? Because they make a proven difference in health all across the globe. At Reimagining Schools, we integrated community health workers into 2 selected sites within the Chicago Public School District. And here's what can happen when people work together in a concerted way toward a common vision, which is that of child health equity. Now, Manuel has health insurance because he was enrolled in the Medicaid program. Now, Manuel's family is more food secure because they were enrolled in the food stamps program. A community health worker can do that. Manuel is now connected with a medical home, which is a regular source of high quality, comprehensive care that is accessible, linguistically and culturally competent, and family-centered. A community health worker can do that. This means Manuel's health is monitored, his medications are prescribed, adjusted, and refilled. He and his family know what his asthma triggers are and how to avoid them. They've received their COVID-19 vaccines and other necessary immunizations. And his family has learned how to work effectively with the landlord to keep their housing stable and safe. A community health worker can do that. Manuel has learned to put his inhaler, his spacer, and his EpiPen Jr. into his backpack as he gets ready for school each morning. Community health worker can do that. Manuel's teachers and the school nurse know about his chronic condition, and they are prepared to help him manage it during the school day. A community health worker can do that. Manuel and his family are now connected with grief counseling and with other types of therapy. A community health worker can do that. In short, Manuel's illness has been uncoupled from the social conditions within which he exists. His illness has been uncoupled from the health and educational harm it typically and tragically and unnecessarily produces. A community health worker can do that. In sum, the use of community health workers is a globally proven, effective way to screen, to navigate, and to manage chronic illness. And now we have an innovative and scalable model to use community health workers in schools to do precisely these things. Robert Wood Johnson Clinical Scholars did that. The model is scalable because of the legal and policy reforms we, along with partners, have written about, advocated, and fought for successfully. Manuel waves goodbye to his abuelita in the bright, sharp sparkle of morning. Abrazos y besitos. See you after school. And she replies, Vaya con Dios. Salud, el médico volador. Thank you.